Hello friends, welcome to EZI Nurse where nursing education made easy. In this session, we will dive into the most important and expected topic, the key topic of biochemistry and biophysics for post-basic BSc first year. This topic are very essential to know to understand our life at the molecular level, and mastering in this topic will help you for the better study. So let's get started. So our first question is, describe the classification of carbohydrate with example. So here we will discuss what is the basic classification of carbohydrate and whatever the examples are there of carbohydrate. So first one is carbohydrate are an organic compound made up of carbon, hydrogen and oxygen. So the carbohydrate is basically made up of carbon, hydrogen and oxygen. They are classified based on their chemical structure. So according to the structure and number of sugar unit they contain, according to that the classification is given. So there are three main categories of carbohydrate. So first one is a monosaccharide, second one is a disaccharide and third one is a polysaccharide. So the basic thing is the carbohydrate is made up of carbon, hydrogen and oxygen, and the classification is based on the structure and number of sugar unit it is consisting. Next, we will discuss about the monosaccharides. So monosaccharides are the simplest form of carbohydrate and they consist of the single sugar unit and cannot be hydrolyzed into the simple sugar. They serve as a building blocks for the more complex carbohydrate. So, monosaccharide are the very simplest form. Such like we are considering one molecule is there, one little molecule. We cannot break it like that much monosaccharide will be. Okay, and it consists of only sugar molecule, single sugar molecule, and it can help to make various complex compound of the carbohydrate. So if there is this molecule, this is a carbohydrate. So while consisting of the molecule, we can make the complex carbohydrate. Next is a carbohydrates and its classification as you can see in this diagram. So it is given, see, first one is a monosaccharide, second one is a oligosaccharide and third one is a polysaccharide. So monosaccharide we have already discussed. So the example of the monosaccharides are the galactose, fructose, ribose, deoxyribose and glucose. Next one is a oligosaccharide. So oligosaccharide are such a carbohydrate compound. If you will break it, so only 2 to 10 monosaccharides will be there. So that is what oligosaccharides. So the example of the oligosaccharides are sucrose, lactose, maltose and raffinose. Next one is a polysaccharide. So polysaccharide, if you break the polysaccharide, so more and more, like many more number of monosaccharide will be present in the polysaccharides. So here it is given many. So many means more and more compound, more and more molecule of monosaccharide will be present in the polysaccharide. So complex and abundant in nature. So it is very complex structure. So the example of the polysaccharide is the starch, glycogen and cellulose. So here it is given disaccharide. So disaccharide is one of the most important classification. After monosaccharide, you can write disaccharide also. After that, you can go for the oligosaccharide and polysaccharide. So these four classification you can mention while you draw the diagram in your exam. So disaccharides are the carbohydrate formed by the linkage of two monosaccharides. So only two monosaccharides molecule will be present in the disaccharides. So it will be bonded together by the glycosidic bond and they can be hydrolyzed into the two monosaccharide. So if two molecule of monosaccharide is there, you will call it as a disaccharide. Okay, and it is combined together with the help of glycosidic bond, and if you break this bond, then two molecule of monosaccharide will be there. Next one is a polysaccharides. So polysaccharides are the complex carbohydrate made up of many monosaccharides unit linkage together and they serve as a strong form of energy or a structural components in the living organism. Polysaccharide can be linear or branch. So polysaccharide is a complex structure. So it can be in the linear form or it can be in the branch like this form it is there. So this is all about the carbohydrates and its classification. Next we will discuss the urea cycle. So urea cycle is also known as ornithine cycle. So it is a metabolic pathway in the liver that convert the toxic ammonia into the urea. So basically in our body, the protein is there, right? So protein is break and it will convert into the amino acid. And this amino acid is nothing but what? Nitrogenous compound. In that amino acid, you will find the ammonia. Okay, so which can then be safely excreted by the kidney in the urea. So ammonia is a water insoluble and it is more toxic than urea. So urea is a water soluble and less toxic. So that's why we are converting ammonia into urea. Okay, so this cycle is crucial for the detoxification of ammonia, which is byproduct of protein metabolism. So because of protein metabolism, this ammonia is forming in our body and this ammonia is more toxic, so we cannot excrete it out of the body. So that's why we have to convert this ammonia into the urea. So that is what urea cycle is and can be harmful if allowed to accumulate in the body. So if it will get accumulated in our body, will get condensed in our body, so it will be harmful to us. Next, we will discuss the steps of urea cycle. So urea cycle is a very simple steps is there. Only 5 important chemical and molecules are involved there, which you have to remember. Okay, so see, the urea cycle involve a series of biochemical reaction with the specific enzymes in the liver. Okay, so this thing, that conversion of ammonia into the urea will be takes place in the liver. And here the outline of the step. So the first step of the urea cycle is the formation of carbohydrate phosphate. So here what will happen? So the ammonia and carbon dioxide combine and to form the carbohydrate phosphate in reaction that require ATP. So what happened here? Ammonia is combining with carbon dioxide and it is giving a molecule that is a carbohydrate phosphate. And this reaction will take place with the help of ATP. So 2 molecules of ATP will be required here and that will convert into the 2 molecules of ADP. This reaction is catalyzed by the enzyme that is a carbohydrate phosphate synthesis first. In the presence of this enzyme, this reaction will take place. Okay, and this reaction will be takes place in the mitochondria. Next one is a formation of citrulline. As we have seen here, like this ammonia is combined with carbon dioxide and it have given the carbohydrate phosphate to us. Now we will see how the citrulline formation will be takes place there. So carbohydrate phosphate react with the ornithine to form the citrulline in the reaction catalyzed by the ornithine transcarbamylase. So what will happen? This carbohydrate phosphate will enter in the cytoplasm, it will get entered. From here this ornithine will be come here and they will get combined and they will form the citrulline. So citrulline is then transported from the mitochondria to the cytoplasm and then this citrulline will get transferred into the cytosol. Okay, so this cytosol will get citrulline. Next one is the formation of the arginosuccinate. So what will happen here? Next, the cytoplasm, citrulline combined with aspartate, another amino acid to form the arginosuccinate. So what will happen here? Once the citrulline enter in the cytoplasm, this citrulline will combine with aspartate. So one molecule of aspartate will be combined with citrulline and it will form arginosuccinate in the presence of the enzyme arginosuccinate synthetase. And this reaction is catalyzed by the arginosuccinate synthesis and use another molecule of ATP. So here is also one molecule of ATP will be used. Next one is the formation of arginine. So here the formation of arginine will take place. But how? This arginosuccinate is then cleavaged by the arginosuccinate lineage to produce the arginine and fumarate. So this arginosuccinate will get break and this breakage will takes place, will give us a 2 compound that is a fumarate and arginine. Okay, so this fumarate can enter in the citric acid cycle, TCA cycle to generate energy. So that fumarate will go in the citric acid cycle and this arginine will be left here. So next what will happen? The formation of urea will be takes place over here as you can see in the diagram. Finally, arginase break down arginine into the urea and ornithine. So this arginase enzyme will be there and that will break down this arginine, and because of this breakdown we will get the urea as well as some amount of water is there and ornithine formation is also takes place there. So urea is then transported to the kidney for excretion. So once the formation of urea takes place, this urea will go to the kidney for the excretion, while ornithine is recycled back into the mitochondria to continue the cycle. So ornithine will be there only to continue this cycle. So this is the very simple and basic steps in the urea cycle. Here I have made one mnemonics for you guys. So please pay attention. Ordinary cats crave awesome fish always. So see, ordinary means ornithine, cat means carbamyl phosphate, crave means citrulline, awesome means arginosuccinate, fish means fumarate, and always means arginine. So basic these steps are there, right? So you can remind this mnemonic for your exam, and with this mnemonic you can go and definitely it will help you to write in your exam. Next we will discuss about the glucose tolerance test. So glucose tolerance test is a diagnostic test used to measure the body ability to regulate a blood glucose level, right? So it helps to identify abnormalities in the glucose metabolism. So if there is any abnormality in the glucose metabolism, so with the help of glucose tolerance test, we can identify that, particularly in diagnosing diabetes mellitus and gestational diabetes. So if the person is having diabetes mellitus or gestational diabetes, so with the help of glucose tolerance test, we can identify that. Next one is the types of glucose tolerance test. So basically there are two types of the glucose tolerance test. First one is the oral glucose tolerance test and second one is the intravenous glucose tolerance test. So in the oral glucose tolerance test, it is the most common type in which a glucose is ingested orally. So glucose we will take by oral. Okay. Next one is a intravenous. So glucose is injected into the bloodstream and used less commonly, mainly for those who cannot take oral glucose. So who are the patient is there who cannot take oral glucose? For them, we can go for the intravenous GTT. Next one is the procedure, how this will take place. So first one is a preparation. So we will focus on the preparation. So the individual must fast for 8 to 12 hours before the test. So the individual should not have anything up to 8 to 12 hours. Next, avoid strenuous physical activity before the test as it influences the result. So we should not do any gym activity or any exercise as it will affect our result. Next one is a baseline measurement. So the blood sample is taken to measure the fasting blood glucose level, establishing a baseline. Okay. So if you are empty stomach before 8 to 12 hours, so after that particular period of time, the doctor or the nurse will draw a sample from your body, that is a fasting, to check the fasting glucose level, and they will establish what is the baseline is there. Next one is a glucose ingestion. So the person drink a glucose solution usually containing 75 gram of glucose for adult or 50 gram in the gestational diabetes test. So most commonly after doing this fasting blood sugar test, after doing that, so we will tell the patient to take 75 gram of glucose, but in the case of pregnant lady, we will tell her to take 50 gram of sugar orally. Okay. Next this, what we will do? We will take the blood sample again after the 30 minute, 1 hour, after 2 hour after the ingestion. And we will see after 30 minutes what is the normal glucose level of that patient. After 1 hour we will check. After 2 hours we will again check to measure the how blood glucose level is changing over time. Okay. Next one is a monitoring. So the blood glucose level are monitored to see if the body can return the glucose level to the normal range with a specific time frame. So we will observe here that blood glucose level is coming back to the normal level or not. So interpretation of the result. For the 2 hour of OGTT, blood glucose level return to less than 140. So after 2 hours, if the patient blood glucose level return and come back less than 140, so we will consider it as a normal. Next one is a pre-diabetic. So when we will say the patient is a pre-diabetic, if the glucose level after 2 hours, it is between 140 to 199 mg per dl. And if we will consider the patient as a diabetic when the blood glucose level will be more than 200 after the 2 hours. So in this, we will do the glucose tolerance test, and this is the interpretation of the result. Next one is a gestational diabetes test. So in this gestational diabetes test for pregnant woman, 1 hour of glucose challenge test with 50 gram of glucose is often used in the screening test. So we will use here only 50 gram of glucose. If the blood glucose level is more than 140 mg per dl after 1 hour, full OGTT is recommended and confirmation. So we will ask the patient to do the full OGTT and we will try to confirm either the lady is having diabetes, gestational diabetes is there or not. So what is the purpose and uses of this? So it will help for the diagnosing diabetes, assess the body ability to process the glucose effectively. Next one is a screening for the gestational diabetes. We will check whether that lady is having gestational diabetes or not, and which is most commonly done in the 24 to 28 week of pregnancy. Next one is a monitoring for the impaired glucose tolerance. So early detection help in managing lifestyle change to prevent the diabetes. So early modification means we will try to change the lifestyle from the previous time once we have done this OGTT test, and we will try to prevent the further complication that is going to cause because of diabetes. This GGTT is valuable tool in identifying diabetes and prediabetes, allowing for the early intervention and management to prevent the complications. Next we will discuss, this comes under the biophysics. Okay, previously we have discussed the biochemistry. Now we are going to discuss the important question of the biophysics. So the first question is, what is lever? Describe the different types of lever. So what is lever? So lever is what? It is a simple mechanical device that will allow the small force is applied at one point to move heavier object at another point. Okay, so lever is what? It is a mechanical device and we will apply some effort, some force from one side and the load will be at the one side, and that is what is lever. That is a simple mechanical device it is. So a lever consists of the three main parts. So it is consisting of the three main parts. First one is the fulcrum, second one is the effort, and third one is a load. Okay, so as you can see in the diagram, the fulcrum is present in the middle. And this is what the effort that we are putting, and this is load. So this is the three main important component of the lever. So fulcrum is a fixed pivot point around which the lever rotates. Next, effort, the force applied to move the load, and load is what? The resistance or weight that need to be moved. Next, lever works on the principle of mechanical advantages, where the positioning of the fulcrum, efforts and loads can be increase the force applied. So according to the change in the position, each and everything and the force what we are applying, it will going to change. And there are three types of the lever based on the arrangement of the fulcrum, load and effort. So on the basis of position of these three things, there will be a type of lever. So as you can see in this diagram, the class 1 lever. So here what will happen, the fulcrum will be in the center, and the load will be at the one side and the effort will be at other side. So see in the description. So in the first class level, the fulcrum is positioned between the effort and load. So example of this is a seesaw and scissor, cowboys and pellets. Example in the real life is a seesaw. So the pivot. So pivot will be there, that is a fulcrum is in the center with the effort applied on the one end and the load will be on the opposite side, that is the other person on the opposite side. So what is there in the seesaw? Seesaw will be like this, right? One person will be here, one person will be here, and in the middle there is a one part is there. We will consider it as a fulcrum. So from one side you will apply the effort, and other side there is one person, that is what load. So this is the class 1 lever, and this is the example of first class lever. Next we will discuss the class 2 lever. So in the description, in the second class lever, the load is positioned between the fulcrum and effort. So here as you can see, the load is in between. In the first class, the load is here, but in the second class, load is in the center. Okay, so load will be in the center, fulcrum will be at the one side and effort will be at the other side. So the example is a wheelbarrow, nutcracker, bottle opener and stapler. So we will see the wheelbarrow. See, in the wheel, this is a wheelbarrow, right? This is in the diagram, it is a wheelbarrow. So here, this is what fulcrum is there. And here we will apply the force, that is effort we are putting here. And the load which we are going to carry, it will be present here. So this is the class 2 lever. Next one is a class 3 lever. So description, In the third class lever, the effort is positioned between the fulcrum and the load. So here what will happen? Now the load is shifted in the corner and this effort will be in the center. So that is what our third class lever. So the example of this is fishing rod and human forearm. So as you can see in this diagram, the fulcrum is at one side. So here we are putting the effort. Here from this side we are giving the effort and load is here. So this is the example of class third level. So this question, I think it is very important because last year it has asked and maybe this time also they can ask. So this question is very important to prepare. Okay. So this question can become for 5 marks. Next we will discuss about state and explain the Newton's law of motion, list the clinical application of gravity in nursing. So there are 3 Newton's law of motion as we have learned in the our basic classes. So we will see what is the 3 Newton's law of motion and how we can apply this gravity in the nursing. Okay, so we will discuss the first Newton law of motion. So what is the statement of this? This first Newton law of motion is also called as a law of inertia. Okay, so the statement is an object at rest will remain at rest and an object in the motion will remain in the motion at the constant velocity unless acted upon by the external force. So the thing is, I will give you example here with the help of this diagram. We will see. So if this ball is here and it is not moving, it is stable there, it is there only, it is in the resting position. So unless and until we did not apply any external force or we did not kick that ball, so until that period of time that ball will be there. But once you kick, it will go forward with the same velocity, with the same speed, that ball will go up to any external force is not there. Means if I have kicked this ball, so the ball will go forward and once the net is there, that external force is exerted towards the ball, so that ball will stop. So that is the first Newton law of motion. So the example in the nursing is the patient is lying in the bed, will stay in the same position unless moved by the nurse or the support device. So patient will be in the bed, means patient is in the resting position unless and until we did not give the position to the patient. Next is a Newton's second law of motion, that is a law of acceleration. And what it is saying? Acceleration of an object is directly proportional to the net force acting on it and inversely proportional to its mass. So see in the diagram it is given F is equal to ma. So this is the second law of Newton. So what is their mass here? So what it will be? A is equal to F upon m. Means what is happening here? This acceleration is directly proportionating to the force and indirectly it will proportionating to the mass. So it is given in the statement. Okay. So see in this diagram, the force is going opposite, the acceleration will be here and the mass will be here. Okay. So this is the Newton's second law of motion. Next we will going to discuss the example of Newton's second law. So in transferring the patient, heavier the patient means the greater mass will be there, the more force on a nurse need to apply to the achieved movement. So if we want to achieve the movement, so we have to apply the more force towards that patient for that patient because the patient is having more weight. So this is the example of the second Newton law. Then third one is a Newton's third law of motion, that is action and reaction. So the statement is for every action there is an equal and opposite reaction. So in your basic classes, in your previous classes, the teacher must have given you this example. If you slap your friend, so that friend will also slap you back with that same intensity. This is the most common example which is given by the teacher. So we will see the different example of this. So when the patient pushes against the bed while trying to sit up. So when the patient will sit on the bed, he will apply some force, he will push the bed down, but bed will also push it back with the equal force, okay, providing the support needed for the patient to move. So this is all about the Newton's law of motion. Next we will going to discuss about the clinical application of gravity in the nursing. So how the gravity is helpful, how the gravity is helping nursing field, okay. So the gravity plays a significant role in the many aspects of the patient care and treatment. Here are some of the clinical application of the gravity in the nursing. So first one is a patient position. So patient position will be different for the different disease condition. So if the patient is having any respiratory function or any respiratory dysfunction is there in the patient, so we will give the Fowler's position to the patient so that the breathing will be facilitated. So for the positioning, this gravity will be helpful. So adjusting the patient position such as elevating the head of the bed, use gravity to improve the respiratory function, blood circulation and comfort. Next one is a wound drainage. So if the patient is having wound drainage with him, okay, so what will happen, that drainer will be drain that amount of pus or any impurities in there, so that wound drainage will be there and it will suck all the things which is impure, right? So it is happening because of what? Because of gravity. Okay, so the gravity assists in the wound drainage by helping the fluids and drain away from the wound side, reducing the risk of infection and promote healing. And it will help to reduce the risk as well as it will promote for the healing. Next one is a intravenous infusion. So there is a IV bottle. Okay, so IV bottle will be there above the height of the bed. Okay, and that because of that, only because of gravity, that fluid will come down because of that IV set. Okay, so the gravity is used to regulate the flow of IV fluids when using the gravity fed IV drips, where the height of the IV bag above the patient heart control the infusion rate. Okay, next one is a mobility and rehabilitation. For mobility purpose, for rehabilitation purpose also, this gravity will be helpful for the patient. So gravity can assist or resist movement, aiding in the physical therapy and rehabilitation exercises. So blood pressure management. In the last, blood pressure management also, it is done by only gravity. So positioning the patient with the gravity can influence the blood circulation and blood pressure, such as in the case of hypertension or shock. So this is the clinical application of the gravity in the nursing. Next, we will going to discuss about the fundamental unit and derived unit and what is the basic difference between this fundamental unit and derived unit. So the fundamental unit and derived unit are the different unit that we use in the daily life. So the fundamental unit and derived unit are both type of the physical unit used in the measurement. So whatever we are going to measure, for after measuring that thing, we used to put some unit. Okay, so for our weight we are putting kg. Okay, kgs or gram we used to put like that. So that is what our unit is. Okay, but they differ in their definition and how they are formed. Okay, so we will see what is a fundamental unit. So fundamental unit, also known as a basic unit, are the standard unit of the measurement for the physical quantity that cannot be described in the other quantities. Okay, these units are independent and serve as a foundation for all other measurement. For all other measurement, it is also used and it is independent. It is not depend on anyone, and to measure the physical quantity, we will use this fundamental unit. So the example of this is length. So length unit is meter, mass unit is kilogram, time unit is second, electrical current ampere, temperature Kelvin. Okay, so this is the fundamental unit. Now we will discuss the derived unit. So the derived unit are formed by the combining the fundamental unit using the mathematical relationship. So here the derived unit is formed because of fundamental unit. Okay, such as a multiplication or division we will use, and this unit describe the quantities that are derived from the basic physical concept. For example, it is given speed. So here in the speed, we are measuring how much distance is covered and at what time we will check. So this is what derived unit. And the example of this is a force, energy and pressure. Okay. Next, we will discuss the main difference of this fundamental unit and derived unit. So as you can see in the definition, basic unit that cannot be derived from other. So this is the basic unit. It cannot be derived from any other. This is the same. This is stagnant. Okay. But the derived unit can be changed and it is derived from only the fundamental unit. So unit that are derived from the fundamental unit, that is the derived unit. Next one is an example. So meter, kilometer, second, ampere, this is the example of the fundamental unit. Then speed, force, energy, pressure, this is the example of the derived unit. Next one is the independence. So depend on the other unit. Okay, so means it is independent of the other unit. So this fundamental unit will be not depend on anyone. It is having its own unit and it is not depend on any another unit, just like a derived unit. So the derived unit is dependent on the fundamental unit. Next one is a formation. Cannot be formed from other units. So it is formed independently. It should not depend upon anyone for its formation. Next one is a formed by the combination of the fundamental unit. Next one is a use in the measurement. Use in the basic physical quantities. So for the measuring the basic physical quantity such as our weight, time, for these things only we will use the fundamental unit, and it is used for the derived quantities. So whatever the derived quantity is there, such as a force, energy, pressure is there, for measuring these things we will use this derived unit. So this is all about this session. I hope you have understand. So keep learning and keep growing with EZI Nurse. Until then, bye bye and take care.